Okay. Um, Good evening, everyone. I'm Dr. Niharika. Today I'll be taking a class on immunization. So basically, what is immunization? Immunization is the process of administration of vaccines to make a person immune or resistant to an infectious disease. These vaccines, which are administered, will stimulate the body's immune system to fight against any of the future infections. Please stop me if you're unable to understand something or if you want me to go slow. Uh, coming to the types of vaccine. I'm sorry, the slide has not come up, but basically there are two types of vaccine, two main types of categories of vaccine, that is live attenuated vaccines and the second one being killed inactivated vaccines. So in the live attenuated vaccines, we have BCG, measles, MMR, chickenpox vaccine. So these live attenuated vaccines are the ones which stimulate our cell-mediated immunity. Okay, so and they are longer lasting as compared to the killed or inactivated vaccine. These killed inactivated vaccines will stimulate the B cells to produce antibodies and to act and to produce memory cells, which will go ahead and will act on the next infections. These killed vaccines are divided into three types. That's inactivated toxins or toxides, which include the diphtheria and tetanus toxoid, killed organisms, which include whole cell pertussis vaccine, and subunit vaccine, which include your hepatitis B vaccine, typhoid conjugate vaccine, meningococcal vaccines, or influenza vaccines. There are certain things that you need to know about a vaccine, that which include what is the meaning of vaccine efficacy, what is vaccine effectiveness, what is herd immunity, and what is a herd effect. Coming to vaccine efficacy means the ability of the vaccine to protect an individual. So it is calculated by your attack rate in an unimmunized population minus the attack rate in the vaccinated population into 100 divided by the attack rate in unvaccinated population. What is vaccine effectiveness? It is the ability of the vaccine to protect an entire community. Here, vaccine efficacy is the ability to protect an individual, and the vaccine effectiveness is to protect the entire community. This vaccine effectiveness is calculated as sum of herd effect and vaccine efficacy. What is herd effect? There are two terminologies that we need to remember. One is herd immunity, the other is herd effect. What is herd immunity? Herd immunity is the proportion of subject with immunity in a given population. So, and herd effect is the reduction of infection or disease in the unimmunized segment as a result of immunizing a proportion of the population. So herd effect is actually the immunity that is gained in the unimmunized as a result of immunizing the other subset of the population and not immunizing them. Okay. Next important thing is vaccine storage and distribution. So the main thing that
previous slide.
Yeah, sure. This is herd immunity versus herd effect. Yeah, can you see it? Okay.
Yes,
Basically,
you can see that we cannot understand second point, herd effect.
Herd effect is you're immunizing the basically what a oral polio vaccine does. So you're immunizing a population, but some within that population might remain unimmunized. Not all of them get immunized, right? In when you're conducting an immunization camp or immunization day, not every child will come to your immunization clinic, right? So you're immunizing a particular population out of which some might get immunized, some might remain unimmunized. So this unimmunized population will also gain the benefit of immunization because some of the immunized population which is there will not will actually not get infected, so the other will get protected. Did you get it or you're confused still? So what polio vaccine does is, when you're immunizing a certain population with oral polio vaccine, this oral polio vaccine will be excreted in the in their stools. So that vaccine will provide an protection to the unimmunized population. Is there some confusion still? Please tell me.
Yes, ma'am. Whether we have given one polio vaccine, ma'am, is that
Yes,
excluded in the schools or?
it will, because it is an oral polio vaccine, right? So the
Yes.
vaccine will get excreted in the stool, and that is how the unimmunized population also will get immunized.
And these live attenuated vaccines will be having property of replication, ma'am. That
They
means some.
will, no, why that attenuated is used is because they are effectively, the antigens do remain, but their property to infect an organism, infect a host body is killed.
My question is, ma'am,
Mm,
suppose we are giving 0.5 ml of oral
mm,
polio vaccine, ma'am, 2
mm.
drops.
Yeah.
The quantity for the subsequent stools will be reduced, no, ma'am. So my question is
Yeah.
whether those polio vaccine is also having ability to replicate.
No, they'll not have the ability to replicate. But one more thing is this: once you have immunized one population, right? A certain more than 50% of the population, if you have immunized, that population will not have further oral polio. I'm sorry, polio infections, right?
Yes, ma'am.
Yeah. So when the vaccine, when you're cutting off the infection in a certain population, the remaining will not get infected.
How, ma'am?
See, polio is basically, it is by oral feco-oral route only, right? The infection of polio is by feco-oral route.
Yes, ma'am.
Yeah. So once that vaccine is there in the stools, also the other polio vaccine, the wild polio vaccine, cannot survive in that.
Okay.
Okay.
Yes, ma'am.
Okay. Shall I continue?
Yes, ma'am.
Okay. So next is the next other thing, important thing that you need to know is vaccine storage and distribution. So the main thing that you need to know is what is cold chain. So cold chain is the system of transporting and storing vaccines within a recommended temperature from the site of manufacture till the site of administration. Why is it important? Why this cold chain is important is because once a vaccine is exposed to the heat, it will start losing its potency. So even if you immunize a population, there will not be any effect out of that vaccine. It will not benefit the population further. Okay. So this cold chain the equipments vary. There can be ice-lined refrigerators, there can be deep freezers, there can be cold boxes, and there can be vaccine carriers. This Iceland refrigerator again come in 300 liters and 140 liters. So this 300 liters is for the main regional and district headquarters, and then the 140 liters is for the PHCs. Then the deep freezer is for the preparation of ice packs and storing OPV vaccine. What you need to remember is deep freezers are the ones in which OPV vaccines are stored, and preparation of ice packs are done in these deep freezers, and they are for the regional and the district headquarters. Okay, and majority of the vaccines have to be stored at +2 to +8 degrees Celsius. Only those frozen only these ice packs and OPV is being stored at less than -20 degrees, less than -15 degrees Celsius. Okay. So the next one is something called vaccine carrier. Cold boxes, you don't have to know so much about it. Vaccine carriers are the ones from wherein from the PHC to the sub center, you carry the vaccines in during the immunization day. From PHC to the sub center, you carry it in vaccine carrier. So this vaccine carrier will have 4 ice packs within it, and the prescribed amount of vaccine vials are stored in the vaccine carriers and taken from PHC to the subcenter level.
Ma'am, can you put the slide of definition of the cold chain?
Yeah.
Yes, ma'am. Thank you.
Okay. Shall I continue?
Yes, ma'am.
Okay. This is a picture of vaccine storage. See, in this picture, what you are showing is a domestic refrigerator. But ideally, none of the vaccines should be stored in a domestic refrigerator. If there are no other equipments available like your deep freezers or iceland refrigerator or a vaccine carrier, only and only then can you use a domestic refrigerator, provided you're not using it for storing any other things other than the vaccines. If you're using a domestic refrigerator for vaccine storage, only vaccines need to be kept in that domestic refrigerator. Okay, and nothing should be kept in the door of the vaccine store of this refrigerator. Okay, next, you can see that lowermost has the water bottles labeled as water bottles there. Why these water bottles are required is because if at any point of time there is a loss of supply or electricity supply, then these water bottles which are already frozen or which are frozen will provide equal distribution of the um, cold temperature within the refrigerator when there is power supply, cut off power supply. Okay. Then in this you can see that OPV and measles are stored in the top compartment. Why this is done is because OPV is the most heat sensitive vaccine. Next is the measles or the MMR and MR vaccines. So this is why OPV and measles are kept in the top compartment. Next is BCG. Next in the middle compartment is the BCG, and then is DPT, TT, and diluent. Why these DPT, TT, even hepatitis B, all the T vaccines, that is DPT, TT, diluent, and hepatitis B, these are more cold sensitive. They are freeze sensitive vaccines. So they should never be kept on the top shelf and they should always be kept on the lower shelf. Can I move forward? Is there any doubt here?
No, ma'am.
Okay.
No, ma'am.
Okay. Next, one more important thing is this vaccine vial monitor. What is it? As we call it as VVM. It is a thermochromic label which is placed on the vaccine vials and it records the cumulative effect of heat exposure over time. These are mainly seen in, you might have seen it, it is present on the BCG vials and the OPV vials. It is basically a quality check. Okay, so these, wherever there is whichever vial, vaccine vial has vaccine vial monitor attached to it, they are the more heat sensitive vaccines and they should never be kept outside for more than 4 hours, and once opened they should be used within 4 to 6 hours. So this vaccine vial monitor has a darker outer circle and a lighter inner square. So the first one is how it comes from the manufacturer. That is, the inner square is lighter and the outer ring is darker, and the expiry date has not been passed. In this case, you can use this vaccine. Next, second one, the inner square is still lighter than the outer ring, but it is beginning to darken. Even then, you can use the vaccine for immunization. But if it becomes equal to the outer circle, or if it becomes darker than the outer circle, then you are not supposed to use it for the immunization, and that vial needs to be discarded. Is that okay? I'll continue.
Yes, ma'am.
Okay. Next is adverse events following immunization. So there are 5 adverse events that can happen following an immunization. Why this is important is because if it is related to the vaccine vial that has been provided, then there is some problem with the quality of that vaccine and the entire manufactured batch has to be removed from the circulation, and an investigation has to be done as to why this AEFI occurred. So AEFI can be of 5 types. One is vaccine product related reaction. Second is vaccine quality defect related reaction. Third is immunization error related reaction. Fourth is immunization anxiety related reaction. And fifth is the coincidental event. This vaccine product related reaction, it cannot be undone. There is nothing you can do to prevent this. The best example for this is DPT vaccine. The pertussis component of this DPT vaccine can cause seizures in a child. You cannot do anything to prevent it. Certain few children will become susceptible to the seizures, few of them may not. Okay, so this is an unpreventable kind of AEFI. Vaccine quality defected related reaction is, suppose a manufacturer doesn't appropriately attenuate the or kill or inactivate the polio virus in the IPV or the OPV part, then the immunized children can develop vaccine derived paralytic polio. This is quality defect related reaction. Next is the third one is immunization error related reaction. This happens basically at the time of vaccination of the children, wherein maybe you have not taken the appropriate amount of the vaccine, or you have not used the correct syringe, or you have given it subcutaneously instead of giving it intramuscularly. This is immunization error related. Immunization anxiety related is, this is more seen in the older children, wherein because of the fear of the needle, they may faint, they may have a syncopal attack. Coincidental event is, you have given the immunization and the child might develop malaria. That is coincidental event. You cannot do anything for coincidental event also. Are there any doubts? Can I go forward?
Yes, ma'am.
Okay. Okay, coming to the schedule. There is, I'm sorry about that black line that you can see, block you can see over there. First, this immunization schedule has been changed now. Instead of previously, as you know, in pregnancy, they used to give TT. Now it has been changed to TD. Okay, so the first dose of TD has to be given in early pregnancy. It can be given as early as the first detection of the pregnancy. So the dose that you give is 0.5 ml and the route is intramuscularly, site is upper arm. The second dose, the black line which you can see, no, there it is written as the second dose of TT, which is given 4 weeks after the first dose of the TT. Okay. The third is the TD booster. If the patient has already received 2 tetanus TD doses in a pregnancy within the last 3 years, then you need to give a single booster dose of TD. But if the pregnancy had occurred more than 3 years prior to the TD dose, then the lady has to receive 2 doses of TD. Okay, for each dose, the dosage is same, which is 0.5 ml, and the route is intramuscular, and the site is upper arm. Any doubts in this? I'm really sorry about that black line there.
Ma'am, what is the full form of TD?
TD is tetanus and diphtheria.
Okay. The single
Okay.
tetanus is not given nowadays.
No, it's not tetanus. It is tetanus and diphtheria. Combination of both is given nowadays. Okay. It has been changed from around 2017.
Yes, ma'am.
Okay. Okay. Next one for infants. So the first, at birth, infants need to receive 3 vaccines. First is BCG, second is hepatitis B, and third is OPV, the 0 dose of OPV. BCG has to be given at birth as early as possible, within one up till 1 year of age. You can give up till 1 year of age the BCG. The dose that is given is 0.05 ml up to 1 month of age, that is up till the neonatal age group. And following that, if the child has missed the birth dose, then you can, after 1 month of age, you can give 0.1 ml up to 1 year of age. The route is intradermal. This you need to remember. Few of the vaccines have intradermal routes, few of them have subcutaneous, few of them oral, few of them have intramuscular, and then few have intranasal route. This is one thing that you people need to remember. Okay, and BCG is given in left upper arm. Does anyone know why that left upper arm? Why left? Sorry,
Non-dominant.
there is nothing. It's basically just that for the continuation purpose. There is nothing like giving in left arm the immunity is increased or giving in right arm the immunity is increased. It is just for universal similarity that it is given in left upper arm. So if you see a scar mark in left upper arm, that means that is BCG. Okay. Okay. Next is hepatitis B birth dose. This is given within 24 hours of birth. I'll discuss why within 24 hours of birth later on. This is the dose of hepatitis B birth dose is 0.5 ml. Route is intramuscular and this is given in the anterolateral aspect of the mid thigh. Zero dose of OPV. Again, why this is called zero dose, I'll discuss it later. It is again, this is also given as early as possible, but within 15 days of the life. The dose that is given is 2 drops and route and site being oral. After birth, the later on is the 6th week of life. At 6 weeks of life, the children have baby needs to receive OPV first dose, fractional IPV first dose, pentavalent first dose, and if that place is giving rotavirus, RVV is rotavirus vaccine. If it has been started, it has been started under National Immunization Schedule from 2017. In Karnataka, it has been started from September of 2019. So if in those areas rotavirus is given, then the first dose of rotavirus also has to be given or at 6 weeks. Okay, so OPV, the first, second, and third dose can be given up to maximum of 5 years of age. Again, 2 drops, and it is given by oral route. Fractional IPV. This IPV is inactivated polio vaccine. Again, the one which is given in our national immunization schedule is fractionated IPV. Why it is called fractionated? I'll discuss it later. This is given at 6 and 14 weeks. Okay, and this can be given a maximum of 1 year of age. It is 0.1 ml that is given, and it is through intradermal route, and this is given at right upper arm. Pentavalent is given at 6, 10, and 14 weeks, maximum age of 1 year. 0.5 ml is the dosage, intramuscular route, and anterolateral aspect of mid thigh. Rotavirus vaccine has 3 doses that needs to be given, that is at 6, 10, and 14 weeks. Maximum age is 1 year of age, and the dose that is given with rotavirus is 5 drops, which is through oral route. This next is PCV. This PCV is pneumococcal conjugate vaccine. This is recommended to be added in the National Immunization Schedule by the Indian Academy of Pediatrics, but it has not yet been added in the National Immunization Schedule. But you can advise the parents to take it outside of the government hospitals, and you can advise them to take this. Okay, so this is given at 6 and 14 weeks, and the booster is given at 9 months of age. Dose being 0.5 ml, intramuscular route, and anterolateral aspect of the mid thigh. Next is at 9 months of age, you are supposed to give the children needs to receive MR. Previously, they used to give only measles vaccine. Now, the recommendation is to give MR, that is measles plus rubella. So, this needs to be given at 9 completed months, that is at the beginning of 10 months, or you can give up to 12 months of age. That is the first dose of MR. The dose that is given is 0.5 ml, and this is one of the vaccines which is given subcutaneously, and this is given in right upper arm. Next, along with MR, you need to give vitamin A. First dose of vitamin A needs to be given to these children. That is given at 9 completed months. The dose being 1 ml and route being oral. Next is JE, that is Japanese encephalitis. Japanese encephalitis virus are given only in 4 states: Uttar Pradesh, West Bengal, Assam, and in Karnataka. This is also given at 9 to 12 months of age, and the maximum age up to which you can give is 15 years. Dose being 0.5 ml, and it is given in subcutaneous route, and the site is left upper arm. Next, coming to for children and adolescent post 1 year of age, the first vaccine at 16 to 24 months, that is 1.5 year to 2 years of age, you need to give them DPT booster, MR booster, and OPV booster. I've already discussed the routes and sites, so I'll not go into that again. JE, wherever it is endemic, there in those places JE vaccine needs to be given. Then vitamin A needs to be given at 18 months of age, and then one dose every 6 months. But after 1 year of age, the dose of vitamin A becomes 2 ml, 2 lakh international units. After the other vaccine is DPT booster, that has to be given at 5 to 6 years of age, maximum age being 7 years. Dose is 0.5 ml, route is intramuscular. And then you need to give, instead of TT, it has been changed to TD at 10 and 16 years of age. Any doubts here?
No, ma'am.
Okay. Okay. Coming to individual vaccine. A BCG vaccine, it is a live attenuated vaccine. This comes in a freeze-dried powder in amber colored bottle. Why whichever vaccine comes in an amber colored bottle, it means that you need to protect that vaccine from light as well, because they are light sensitive also, and they can lose the potency of the vaccine. The strain that is used in BCG is Danish 1331. The diluent used is normal saline. Dose and route I have already discussed, so I'll not go into that. But why intradermal route for BCG is preferred is, BCG vaccine can cause local abscesses and will cause painful axillary lymph nodes if it is given in deeper tissues other than intradermal route. That is why it is given in intradermal route. And why the lesser dosage in newborns is because their skin is very fragile. So if you try to give more than 0.05 ml, the skin can break, and that can cause local abscesses if it penetrates into the deeper tissue. And as I already mentioned, the diluent, I'm sorry if I've not mentioned it before, the diluent that is used in BCG is normal saline. Why you cannot use distilled water is because distilled water is an irritant to the skin. And because this is being given, because BCG is given as an intradermal route, you're not supposed to use distilled water. The complications that arise with BCG vaccine is, one, it can cause prolonged ulceration, it can cause suppurative lymphadenitis, it can cause disseminated BCG infection. This is especially seen, the disseminated BCG infection can happen in children with impaired cell mediated immunity, as seen in severe combined immunodeficiency syndrome or hyper IgE syndrome. Okay. So BCG, when we give, it does not protect the children from pulmonary tuberculosis. What it does protect the children is from miliary tuberculosis and tubercular meningitis. Okay. So BCG vaccine, has to form a scar, and that is the only vaccine which leaves a scar. This scar, for the formation of the scar, it has to go through certain reaction. That those reactions are, first, immediately as soon as you inject the vaccine, there will be a wheal that is formed of 5 mm, which will disappear within a day. Sorry. After 2 to 3 weeks, you see a papule that will develop at the site of the injection. After 5 weeks, this papule which is there will break down to form an ulcer, and then by 6 to 12 weeks, you will find that permanent scar, the classical scar of BCG. And one more thing, even if a scar is not formed, you do not have to revaccinate the child. You have to reassure the parents who come with the doubt that a scar is not visible of BCG vaccine, as long as there is a proper documentation that the BCG has been given. Contraindication for BCG vaccine is basically any live vaccine should not be given when there is impaired cell mediated immunity, which is seen in cases of primary immunodeficiency, or in case of steroid usage in pregnancy, or when the child is receiving chemotherapy or prolonged steroid usage. The other contraindications are generalized eczema and infective dermatosis. Okay. Any doubts with BCG? Okay, I'll continue. Next, coming to oral polio vaccine, which is also called as Sabin vaccine. So this oral polio vaccine have three types of OPV, that is that is manufactured. That is monovalent OPV, trivalent OPV, and bivalent OPV. What does this valency indicate is that whether it indicates the number of serotypes that is present. The monovalent will contain only one serotype of OPV. Trivalent has 3 types of OPV, and bivalent has 2 types of OPV. This trivalent OPV has been globally withdrawn in April of 2016. Please remember this. The vaccine that is being given in our national immunization schedule and globally contains bivalent OPV. Monovalent OPV is also not being used. Bivalent OPV is the one which is being introduced in our national immunization schedule as on April of 2016. Why this was done is because serotype 2 was eradicated in 1999, and further continuation of this serotype within the vaccine would have led to emergence of vaccine derived paralytic polio. That is why the second serotype has been withdrawn from the vaccine. Again, this is also a live attenuated vaccine, dose being 2 drops, as I have already discussed. Contraindication, again, as I told, because it is a live vaccine, you cannot give it to children with immunocompromised state. Also, you are not supposed to give this in if there are any immunocompromised contacts in the household. Just the major side effect that can happen with oral polio vaccine is vaccine associated paralytic polio. Okay. So next, what happens if we give more than 2 drops to a child during the vaccination? Usually there will not be there will not be a problem. But if a large dose like the entire vial is given, then the child can develop mild diarrhea. Nothing to be done for this. Just reassure the parents. Okay, I told you I'll discuss why it is called the zero dose of polio vaccine when it is given at birth. This is because this dose is one thing, it is immediately given after birth, and it is not counted as part of routine immunization. That is why it is not called as first dose. And why this dose is given is because if the child does not get a chance to get immunized further on, if because of some issue the parents are not willing to get immunized, or the child has missed the immunization, at least the child has been given that one dose of oral polio vaccine. That is why it is called a zero dose. Okay. Next is pulse polio immunization. This is nothing but you have already heard about this. It is basically simultaneous of administration of bivalent oral polio vaccine to all the children under 5 in a particular area, and this is done twice a year. Once it has 3 days. I think you people have been told this in your community medicine class, but basically there are 3 days of the immunization that happens. On the first day, the people, which is done on a Sunday, the people are called to a particular place and asked for their children to be immunized. If they don't get immunized on that day, then the ASHA workers in that particular area will go to each house and then check whether the children have been immunized or not. Again, on the third day, there is rechecking of the household. This is how pulse polio immunization works. Why was the serotype 2 removed from the OPV, oral polio vaccine? I have already discussed this, to eradicate any wild transmission of the virus. Okay, how now we have removed this serotype 2 from our oral polio vaccine. So how do we prevent it from re-emerging? This is done by simultaneous administration of fractionated IPV in our national immunization schedule. Okay, I have highlighted that word switch. What is the switches? Switch from trivalent OPV vaccine to bivalent OPV vaccine, which was done as on April of 2016. Okay, coming to inactivated polio vaccine or killed polio vaccine, or the Salk polio vaccine. This is killed or inactivated polio vaccine, and this is given by. Okay, there are 2 doses that can be given. Full dose is 0.5 ml, which is given intramuscularly, and fractionated dose is 0.1 ml, which is given by intradermal route. The schedule is at 6 and 14 weeks. I told I'll discuss why it is called as fractional IPV. It is called fractional IPV because instead of giving 0.5 ml, that is the full dose of a intramuscular vaccine, we are giving only 0.1 ml of this vaccine. Why it was made fractional IPV is because there is scarcity of this IPV vaccine globally. That is why it was made as fractional IPV, that is 0.1 ml is given. And even though 0.1, and also WHO found that there is no difference within the vaccine efficacy of fractional IPV and the full dose IPV. So because they give equal protection, that is why we have continued to give intradermal route 0.1 ml vaccine. Contraindication of any killed vaccine being, the first major contraindication for any killed vaccine is if the patient has already developed any allergic reaction to the previous dose. That is a strict no to be for a further immunization. Other things are thrombocytopenia, and if the child has any bleeding disorder, or if the child is on any immunosuppressant temporarily. Okay. Next is pentavalent vaccine. The composition of pentavalent vaccine as the name suggests has 5 vaccines in it, which include DPT, that is diphtheria, tetanus, and wholesale pertussis. Other than that, they have also added hepatitis B and purified capsular hip polysaccharide. Okay. The schedule of pentavalent vaccine is 6, 10, and 14 weeks. So again, because it is killed vaccine, the contraindications to it includes severe allergic reaction to the previous dose of pentavalent. Though pentavalent, for any killed vaccine, there is requirement of a booster dose, but pentavalent is the one vaccine for which we do not give booster dose. Why pentavalent is not given as a booster is because that is H influenza B vaccine will provide protection for at least 15 years. So you don't have to give another booster dose for them. Side effects are following pentavalent vaccines are very mild, that is fever and pain and swelling at the injection site. Again, nothing to be done for this. But you also have to know about the rare complications of pentavalent vaccine, which include persistent, that is more than 3 hours of inconsolable crying, seizures, hypotonic hyporesponsive episodes or HHE, anaphylaxis or encephalopathy. All these rarer side effects and more severe side effects are seen because of the pertussis component of the pentavalent or the DPT. Okay, next coming to rotavirus vaccine. Again, this is live attenuated vaccine and it is available in liquid form. The bottle is similar to the polio vaccine. How you can differentiate is because the dropper is a little bit larger and it is having a pink or an orange shade to it. There are 3 types of rotavirus that is available in India, which is ROTAVAC, ROTARIX, and ROTATEC. But under our immunization program, ROTAVAC is being given, which is a monovalent live vaccine. And again, it is given in 3 doses, 6, 10, and 14 weeks. The other 2, you people don't have to remember it. I've just given it for the, put it up for the sake of information. That is it. And rotavirus also has vaccine vial monitor in it, and it has to be used within 4 hours. So the dose I have already discussed, which is 5 drops given at 6, 10, and 14 weeks. This rotavirus, you need to remember the minimum age, the maximum, and the maximum age for the final dose, which I have highlighted in red. The minimum age for which you can at which you can administer rotavirus is 6 weeks, because up till that time maternal antibodies will prevent any further infection. And then maximum age up to which you can give the rotavirus is 32 months, that is 32 weeks, that is 8 months. Okay. Contraindications are already, like I've already told regarding live vaccine. Again, the main contraindication for it is immunodeficiency. One other complication that has been observed with rotavirus vaccine is the children can develop intersusception. And if with the previous dose of rotavirus vaccine, her child had developed intersusception, then you're not supposed to give any further dose of rotavirus. Okay. And in rotavirus also, like in you don't have to give any booster, because the vaccine will provide protection up till 2 years of age, by which time the majority of the children would have acquired a natural rotavirus infection, and they would have developed protective antibodies to it. Okay. Next is hepatitis B vaccine. This is a killed recombinant vaccine. What this vaccine actually contains is the antigen S antigen of the hepatitis B virus. So side effects are very mild. They can develop pain, fever, redness at the site of the injection, and few of them can develop influenza-like symptoms. Other than that, they can develop abnormal liver function, which you have to worry about. A contraindication for it being hypersensitivity. I told you why. I'll discuss regarding why only hepatitis B is given only with birth dose of hepatitis B is given only within 24 hours. That is because up till 24 hours, hepatitis B vaccine can prevent any perinatal transmission of the virus. After which it cannot prevent, and there will not be any use of giving that dose. Is there any doubt till now? Do you want me to clear something?
No, ma'am.
Okay.
Ma'am, in BCG, you told it gives protection against miliary tuberculosis and
Tubercular meningitis.
okay, ma'am.
Okay. Fine. Next is measles containing vaccines. The measles containing vaccine are measles, a measles vaccine per se, then the combination of measles and rubella, combination of measles, mumps and rubella, and then measles, mumps, rubella and varicella. But that MMRV is not yet available in India. What we have is MR and MMR vaccine. Measles vaccine is also available separately, but measles vaccine is no more given as a single dose in our national immunization schedule. What is being followed is measles and rubella. Okay, as I've already highlighted there. This is available in a freeze-dried powder, and this requires a diluent. The diluent used here is distilled water because this is being given subcutaneously. Okay, the strains that are used with MMR are in measles vaccine, it is the Edmundston Zagreb strain. In mumps, it is L. Zagreb strain, that is Leningrad Zagreb strain, and with rubella virus, it is Vistar RA27/3. If you guys want the slides, no, I can share it with the coordinator, and then you people can have the slides. Okay.
Yes, ma'am.
Okay. The schedule.
Okay, ma'am.
Yeah. Okay. Okay. Schedule for I've already discussed this. I'll not go into that. Okay. Side effects of measles vaccine. The main side effect that you have to remember is it can cause thrombocytopenic purpura. This is seen in 1 in 30,000 vaccinated individuals. Other than that, it has some few side effects, small minor side effects like fever, transient rash, pain and tenderness at the area, and other major side effect is anaphylaxis. Again, because it is a live vaccine, you're not supposed to give it in immunocompromised patients, and if they have already developed any anaphylactic reaction to the previous dose. JE vaccine, again, it is also a live attenuated vaccine. The strain that is used is SA14142. This is the strain that is being used in India in our vaccine production. Again, this is also a freeze-dried vaccine, and the diluent here is phosphate buffered saline. I already mentioned that it is being given only in 4 states, that is Uttar Pradesh, West Bengal, Assam, and Karnataka. And even in Karnataka, it is being given in only in few states, with 8 districts where JE is endemic. Side effects are again minor side effects that same like fever, rash, and irritability. There are many contraindications for it, which I'll not go in detail with. But again, because it is a live vaccine, what you people need to remember is immunocompromised patients and in pregnancy, and if they're having some severe illnesses, chronic severe illnesses, which includes cardiac, liver, and kidney. Okay. Okay, now the coming vaccines I'll discuss in very briefly. Typhoid vaccine, you give only one single dose of typhoid vaccine, which you can start giving by 6 months of age. From then, anytime you can give the vaccine, but only single doses given according to the Indian Academy of Pediatrics. If instead of typhoid conjugate vaccine, the child has been given typhoid polysaccharide vaccine, then after 4 weeks of the typhoid polysaccharide vaccine, you need to give 1 dose of typhoid conjugate vaccine. Okay, one more thing regarding polysaccharide vaccine. There are a few vaccines have conjugated vaccines and polysaccharide vaccine. This polysaccharide vaccine should never be given below 2 years of age. Okay, because they cannot induce the antibody or immunity very efficiently. That is why below 2 years of age, you should never give polysaccharide vaccine. Okay, next is pneumococcal vaccine. Again, minimum age for starting pneumococcal vaccine is 6 weeks. The dosage is 6 weeks, 14 weeks, and then a booster at 9 months of age. There are few different conjugated vaccines that are available: PCV10, PCV13, and PCV7. India has PCV10 and PCV13. PCV7 is no more preferred. What does this 10 and 13 indicate is the serotypes that are available in that vaccine. Studies have shown that 13 serotypes are enough to provide protection against a pneumococcal vaccine, because these are the 13 serotypes which can cause any serious infection within the individual. Okay. I have already told the dosage of it. It is 6 weeks, 14 weeks, and then one more booster at 9 months. This pneumococcal vaccine can have varied dosages. Like there is one more dose which can be given at 6, 10, and 14 weeks, and then you can give a booster at 12 to 15 weeks. But the one which is recommended by our IAP is 6 weeks, 14 weeks, and then at a booster at 9 months. Okay, again, I'm so sorry regarding this slide which has not been shown now, which is not seen. Influenza vaccine is basically an inactivated vaccine. Okay, it is given intranasally. One second. It is given intranasally, and there are 2 types of influenza vaccine. Either it can be trivalent vaccine or quadrivalent vaccine. Both trivalent and quadrivalent vaccine are available in India, but the dosage is again, minimum age of starting is 6 months for this influenza vaccine, and between 6 to 59 months, that is up to 5 years, every child should receive influenza vaccine. Above 5 years, only high risk group has to receive. The dosage is between 6 months to 9 years, 2 doses 1 month apart, and 9 years and above, it is single dose. I'll repeat again regarding influenza vaccine. If you're taking down notes, please again take it. Influenza vaccine which is given in India is inactivated influenza vaccine, IIV. In Western countries, there is also live attenuated influenza vaccine, which is not available in India. And this vaccine is given, the live attenuated influenza vaccine is given intranasally, whereas inactivated influenza vaccine is given intramuscularly. What is available in India is inactivated influenza vaccine, and that is given intramuscularly. There are 2 types of inactivated influenza vaccine, trivalent and quadrivalent, both of which are available in India. The dosage schedule is between 6 months to 9 years of age. 2 doses have to be given 1 month apart, and from 9 years and above, only single doses required. And then there is also this because influenza has property of antigenic shift every year prior to the flu season, 2 to 4 weeks prior to this flu season, children or healthcare workers have to be immunized with that particular strain of influenza vaccine. Okay. I'm so sorry regarding the slide. I'll send the proper slide through the coordinators. Okay, if you guys can go through that slide later on. Meningococcal vaccine, the dosage being 2 doses from 9 months to 2 years, at least 3 months apart, and from 2 years through 55 years, single dose. This meningococcal vaccine is not given for everyone in routine immunization. It is given only for children or people who have undergone splenectomy or if they're having any chronic liver disease, or if they're receiving repeated blood transfusion, as in case of thalassemia. Cholera vaccine, minimum age being 1 year, and they require 2 doses 2 weeks apart. Again, not usually given, only when there is any epidemic or a pandemic of cholera, only then you can give the cholera vaccine. Otherwise, it is not required to be given. Next is human papilloma virus. This you need to remember. There are 2 types of human papilloma viruses. That is, virus vaccines. That is HPV-4, which is Gardasil, and HPV-2, which is Cervarix. This Gardasil has all the 4 serotypes. Has 4 serotypes of HPV virus. That is 6, 11, 16, and 18. Whereas HPV-2 has only 16 and 18. Okay. HPV vaccine, only 2 doses need to be given. The minimum age of starting is 9 years. So these 2 doses have to be given between 9 to 14 years. But if the patient or the adolescent comes to you after 14 years of age, then they will require 3 doses. The 3 doses can be is different. The schedule is different for both the HPV-4 and HPV-2. In HPV-4, it is given at 0, 2, and 6 months. And for HPV-2, it is given at 0, 1, and 6 months. Okay. Shall I go forward?
Yes, ma'am.
Okay. These were about the vaccines. Okay. Next on, I have prepared few MCQs. You guys can try answering it. Okay. Okay. What is the ideal temperature for storage of vaccine? Is it 1 to 10 degrees Celsius? Is it 2 to 8 degrees Celsius? Is it 5 to 10 degrees Celsius? Or is it 1 to 5? Anyone can answer this.
2 to 8 degrees.
Yes, it is second one. 2 to 8 degrees Celsius. Okay. Next one. Who is responsible for the maintenance of cold chain? Is it the manufacturer? Is it the distributor? Is it the vaccination staff? Or is it all of these above?
All of them.
Yes, it is all of the above. Okay. Which of the following are true regarding a vaccine refrigerator? Whether vaccines are best stored in the door of the fridge, there should ideally be 5 centimeter between back of the fridge and vaccines. Vaccines should be removed from their boxes so they take up less space, or live vaccines should be stored together on the same shelf. Does anyone know the answer?
Option 2, ma'am.
Yes, answer is option 2. There should be a gap of 5 centimeter. The rest of them are false. Okay, this one I've already given the answer, but which is the most sensitive vaccine? I had already discussed that OPV vaccine and measles vaccine need to be kept on the top shelf, out of which OPV is the most heat sensitive vaccine. I've already shown the answer, but I wanted you people to remember this picture of it, which shows the range from most sensitive to least sensitive. It is different for heat sensitivity and freeze sensitivity. The live vaccines are more heat sensitive and the inactivated vaccines are more freeze sensitive. The most heat sensitive, as I've already told, is OPV, and the most freeze sensitive vaccine is hepatitis B. Okay. Okay. Next one. Herd protection works when the majority of the population is immunized, when only a few people are immunized, when no one is immunized, or when everyone is immunized.
Option 1, ma'am.
Yes, correct. When majority of the population is immunized. Next one. Successful immunization can be impaired by, is it the adjuvant? Is it the cytokines? Is it the cloning? Is it by cloning the vaccine, or is it the maternal antibody?
Cytokines B.
No, it's not. Actually, it is. No, adjuvants, you put adjuvants, add-on adjuvants because you want to increase the immunization, the potency of the vaccine. It is actually maternal antibody. Why maternal antibody is because if the maternal antibody is passively transferred into your baby and you give a vaccine to that baby at less than 6 months of age, then the body will never produce its own antibody. Okay, and this maternal antibody will wane off after 6 months of age. So if the body has not produced its own antibody, then it will not produce any protection for further infection. So it is actually maternal antibody. Okay. Okay. If given in the same limb as another vaccine, the second vaccine should be separated by at least. Is it 0.5 centimeter? Is it 1.5? Is it 2.5? Or is it 3.5 centimeter? Anyone? The answer is actually 2.5 centimeter. That is about 1 inch. Basically, see, there is a thing that once you should not never give live and killed vaccine together, but you can give it on the same day. You have to separate the two vaccines by 1 inch and in the same limb, but you cannot give a live vaccine, a killed vaccine now and live vaccine after 2 to 3 days, because the immunity will be impaired. The body will not produce any antibodies and there is no use of giving any vaccine. Two killed vaccine can be given together within any gap. Even after 2 to 3 days you can give another killed vaccine, but two live vaccines and one killed and one live vaccine should not be given within a gap of 2 to 3 days. There should be a gap of at least 4 weeks between these vaccines. Okay, but you can give them on the same day, but it should be separated by 1 inch. Next, vaccine with a live vaccine should be deferred if the patient is immunocompromised, the patient is premature, patient is breastfeeding, or the patient has family history of epilepsy. I've discussed this.
Immunocompromised.
Yes, that is immunocompromised. Okay, all vaccines are administered subcutaneously except, is it MR, JE, varicella, or typhoid conjugate vaccine? The answer is typhoid conjugate vaccine. Okay, it is given intramuscularly. The rest three are given subcutaneously. Okay, all should receive pre-exposure prophylaxis except, this is with respect to hepatitis B that I have asked the question. Hepatitis B vaccine should be given pre-exposure to whom and all, except.
Acute hepatitis B infection.
Yes, the rest of it, because they can get infected, you have to give the pre-exposure prophylaxis. The pre-exposure prophylaxis schedule is different too as compared to the one which is given to infants at in our routine immunization schedule. The schedule for pre-exposure prophylaxis is 0, 1 and 6 months. Okay, this is the most commonly followed regimen schedule, but you can also give it at 0, 1 and 2 months or 0, 2 and 6 months, but the majority of them follow the 0, 1 and 6 months dosage, and that is again 0.5 ml in intramuscularly. Okay, 0.5 ml is given below 18 years of age, and above 18 years of age it is 1 ml that is given. Okay. Next one, which of the following should not be given hepatitis B? Whether it is those with confirmed anaphylactic reaction, whether it is immunosuppressed individuals, whether it's pregnant women, HIV positive, or premature infants. Anyone?
First option.
Yes, first one, because it is a killed vaccine. The major contraindication for it is if they had developed any allergic reaction to the previous dose of hepatitis. The following is or are true about Gardasil. What do you think? Whether it contains thiomersal, whether it contains HPV type 6, 11, 16 and 18, whether minimum interval between two doses of Gardasil for children and adolescents aged between 9 and below 15 years is 6 months. There is evidence of interchangeability, or if the Gardasil is given at the same time as GTP or DTaP, both vaccines can be given at same site. Gardasil is HPV4. I have given you the clue there.
Option 2, ma'am.
Yes, the rest of them are false. It does not contain thiamarcel, and the minimum gap, as I've already discussed, is 4 weeks, not 6 months. There is no evidence for any interchangeability of the two vaccines. If you have started a immunization with the Gardasil, you have to continue with Gardasil, and if you have started with Cervarix, that only has to be continued. And no vaccine should be given at the same site. I have already discussed this with the previous question. There has to be a gap of at least 1 inch between the two vaccines. Okay. Next one. Following is true about Cervarix. Whether it provides protection against genital warts, whether 3-dose course is interrupted, it should be resumed but not repeated, whether it is given by oral route, or it contains 11 and 16.
Option A, ma'am.
Yes, it provides protection against genital warts. It also, why human papillomavirus vaccine is given is because one, it provides protection against genital warts, and the second thing is it provides protection against CIN 1 and 2, but it cannot provide any protection against CIN 3. Okay. And the last one, this Cervarix contains actually 6 and 11, not 11 and 16. Okay, patients with the following conditions should have seasonal influenza vaccine except class 3 obesity, stage 2 chronic renal disease, diabetes, cystic fibrosis, or whether it is severe learning disability.
Option E.
Yes, it is. All the other candidates fall under high risk groups and they have to receive seasonal influenza vaccine. Okay, this is the last question. Which of the following is or are true about MMR vaccine? It should not be given to children with autism. It should not be given in pregnancy. It is better not to give it if a person has a previous history of either measles, mumps, or rubella. Or if the vaccine is started after age of 18 months, a child needs 2 doses separated by 3 months. It's a live vaccine.
So, autism immunosuppressed.
No, pregnancy is immunosuppressed, not autism. There was some, why I put this question was there was some concerns that the mum's part of it can cause autism, but that has been disproved now. Pregnancy is a condition where there is some immunosuppression. So in a pregnancy, you should never give a live vaccine unless it is very much required to do so. That is like your yellow fever vaccine when they are traveling to a endemic region. When you cannot avoid giving the vaccine, only then can you give the live vaccine. Otherwise, you should never give a live vaccine in pregnancy. Okay. So that was my class. If you guys have any doubts with respect to immunization, which I have taken now, or something else, you can please ask me. No? Nobody has any doubts? Shall I end the class then? Okay, then I'll end the class here. If you guys have any doubts regarding this, you can ask me in the next class. Okay? Thank you.
Hello, ma'am.
Yeah.
Ma'am, sorry to disturb. Ma'am, I have a doubt, ma'am. Can we
Yeah.
give rubella vaccine for the I have read a sentence in community medicine. We
Yeah.
can give rubella vaccine during engagement time, something like as a gift for the.
That is because see, rubella, when if the pregnant woman contracts rubella or the
Okay.
German measles, then the child can develop congenital rubella syndrome. So that
Okay.
is why now we are giving for all adolescents, whether they have received
Okay.
previously MMR or not, all
Mhm.
adolescents have to be given MR vaccine by 15 years of
Okay.
age. That is called catch-up vaccination that has to be given, and that has been done once every 3 years, 3 to 5 years, depending on the cohort that is formed. That is why it is called. That is why that term, that phrase has been
Oh,
used. Okay.
yes, ma'am. Yes, ma'am.
Okay.
Okay, ma'am.
Yeah.
That's it, ma'am. Thank you, ma'am.
Okay. Okay. You're welcome.
Madam, shall we wind up the class, madam?
Yes. Yes.
Thank you so much, madam. Thank you.
Yeah. Thank you.